So I wanted to start with just an introduction and a welcome. Obviously, there's a lot going on in the world, and we're just grateful that we have your attention. There's been so many things happening in the last year, but I think in particular, the last couple of weeks has also been incredible in terms of what has happened, and sad in many ways. But I do believe that we are all going to get through this, and things and better days are ahead of us. So I want to talk a little bit about exposomics. So this is sponsored by the Mount Sinai Institute for Exposomic Research. I'm the co-director with Dr. Wright. And I wanted to introduce the concept because it is environmental health, but it's environmental health on a much broader scale. And I wanted to introduce how it can be applied to better understand climate change. So what is exposomics? So there's different definitions, but I prefer the totality of health relevant environmental exposures throughout a lifetime. And I like to mention that we're mostly interested in the health relevant environmental exposures. You can measure all environment, but not everything in your environment affects your health. So that's why we have to focus it somehow, because the exposome can be kind of daunting in terms of how big it is. The term exposomics was actually coined by Dr. Christopher Wild from IARC, the International Agency on Research on Cancer, in 2005. And he envisioned it as a complement to genomics, so that we not only have to understand how genetics affects our health, we have to understand how environment affects our health. And in fact, everything in life at some level is a gene-environment interaction, and climate is a big part of environment, and it touches virtually every aspect of environmental health. And it's not just toxicology. So I actually come from a toxicology background, and people tend to think of environmental health as sort of a toxicology chemical environment. When we talk about exposomics, it's much more inclusive. We want to look at the social environment as well as the physical and nutritional environment. And we have to factor in that it's time varying. And that in fact, not only is it time varying, it may be important to know when someone's exposed as much as what they were exposed to, particularly in children. I'm a pediatrician, and there are life stages at which exposures are far more toxic than if the same exposure and the same dose was experienced in another life stage. And this is because children's bodies and brains are developing. So you can disrupt that development during childhood, whereas once you're 30, 40 years old, you're not really disrupting development anymore. So the same dose may not be as toxic. So exposomics, as I said, encompasses all environment. It's not just chemicals. And even nutrition and social environment and physical environment aren't really capturing the whole picture. There's things like pollen in the air. There's things like infections and vectors that climate affects as well. So obviously COVID is part of the exposome in the sense that it's an environmental factor that's affecting us. And there are environmental aspects that actually make people more susceptible than others. So when we think about susceptibility, we often default to genetic susceptibility. There is an environmental susceptibility. In fact, I would argue that most health disparities are actually being driven by environmental disparities. So you can divide the exposome broadly into both internal and external. The external exposome are things that you can't really measure in an assay. Climate, many aspects of climate actually do fall into that category, but things like noise and stress also fall into that category. Air pollution falls into that category. They affect the body. They will affect different aspects of chemicals that you can measure in the body, but the root cause where you want to have an intervention is part of the external exposome. And then there's the internal exposome, and many of these are chemicals. So we can actually now with technology measure thousands of chemicals in an assay, and we don't even have to define in advance what they are. We can sort of scan for them. And I think that's going to be really important for climate and health, because there's a lot of what we call butterfly effects of climate on health. So there may be things where the climate change isn't directly causing an effect on your body, but it's affecting a different system that through several steps that are removed ultimately affect your body. And I'll give a couple of examples of that in a minute. So a lot of what we do here at the Institute is actually satellite remote sensing. So there are thousands of satellites circumnavigating the globe. Some of them are geostationary. We can actually use them to measure things like air pollution, weather, temperature, and its variation on day to day or even hour to hour. We can look at green space, so we can look at positive environmental factors. We can look at light at night. There's quite a few different measurements that we can do using satellites. If we know where somebody is, and if you have an iPhone, Apple knows where you are right now. I know that's a little bit scary, but if we know your address, if we know your workplace, we can actually make estimates based on these satellites for the quality of the air that you breathe and the temperature that you're experiencing. And then there's wearable devices. All of us who have an iWatch or some other type of smartwatch is wearing a wearable device. But actually wearable devices are not where it ends. There's also the Internet of Things. Your car is attached to the internet in all likelihood if it's more recently purchased. And so there are other measurements that actually are potentially linkable. And these are devices that we use or can use in research to get an understanding of where you are in geospatial time, but also what are, for example, like linking it to the satellite measurements, what are the environmental conditions around where you are? So we can actually get quite a bit of data. We can also get physiologic data, your heart rate and your blood pressure and such. And these are just some examples of wearable devices like smartwatches and iPhones. And there are even some sensors that people are developing that you can wear to measure things like the amount of chemicals in your sweat. So this field is actually going to grow quite a bit in the next 5 to 10 years. Then I mentioned different types of chemical assays. There's been a lot of improvement in the types and the number of chemicals that we can measure in assays. And now we can scan a biological sample like blood or urine and measure thousands of chemicals all at once. And we don't even have to specify in advance what they are. We can actually look at these peaks and then we can try to figure out what they are from the peaks, rather than saying we're going to measure lead, we're going to measure phthalates. We can actually scan a sample and see what's in there, rather than start with an a priori hypothesis. And that's very important if you're not sure what someone's exposed to. And in most cases, we're not sure what someone's exposed to. So by doing these sorts of scans, we can start to discover what the environmental chemicals are that we're exposed to. So I wanted to talk briefly about butterfly effects in climate and health. So a localized change in a complex system can have effects that are far, far away, and that's what's called a butterfly effect. Climate change is going to have many effects, some of which are direct, but some of them are actually downstream effects. So we're going to have more vector-borne diseases in new geographic areas. So as the climate warms, certain species of mosquitoes are going to be able to live in northern areas of North America longer than they used to be able to. So they'll be able to survive winters because the winters will be milder. And there may be more vector-related diseases. We're actually seeing some changes in Lyme disease, which is actually by a tick-borne disease, because the ticks can actually survive in different climates. There are many, many health disparities issues around climate change. So higher SES, more access to air conditioning. You're going to do better in a heat wave than poorer populations. And so there are some environmental justice and health equity issues around climate and health, which are not necessarily immediately apparent. There are effects of air pollution and heat during pregnancy. So there are vulnerable populations. So the very young are more vulnerable to climate effects, and the very old are more vulnerable to climate effects, both heat and cold. So if a lot of very elderly people live by themselves and they may not be that savvy or may not have the energy or even may have some mental capacity, it may limit their ability to adjust the temperature or even the financial capacity to adjust the temperature in their apartments or their homes, and that can actually lead to health impacts. Urban areas are going to be greater impacted because there's less green space. There's what are called heat islands, which I'm sure we'll hear about later on during the day, but urban areas are far more impacted than suburban areas. And there's going to be impacts on our food supply, both the quality and the nutritional content, as well as our ability to get food and transport it from one area to another is going to be impacted by climate change. And this is actually something we've seen with COVID, but also extreme weather events can have effects. And even the climate itself, the rising carbon dioxide, can actually change the nutritional content of food, which is a butterfly effect. So in summary, climate change is already impacting human health directly. It's not just extreme weather events. There's also indirect effects like vector diseases and others. And there are likely other unappreciated downstream effects. In terms of what we can do, in the Institute for Exposomics. We've set up programs to do satellite remote sensing so that we can understand weather, temperature, and air pollution changes both temporally and geographically. We're developing assays, particularly untargeted assays can help us discover what's actually happening as a climate change so that we can potentially link it to climate and health. And these exposomic approaches can help us better understand the impact of climate change on our health and the impact and health disparities. So we really need to focus on studying the most vulnerable populations, and those are the populations that are poorer and more urban. And we can also measure those trends over time. And by doing so, we can help plan for the future. And that's my last slide.